Do you know, your blood type can have a huge impact on the outcome of your pregnancy? Stay tuned to find out. Hello everyone. Welcome to Nibs. Today, we're exploring the Rhesus factor and why it's vital for expectant parents to be aware of. In accordance with this, we will be sharing vital information as to how to test and manage Rhesus factor. If this interests you, do well to like, subscribe and share to your friends and loved ones. The Rhesus factor, often referred to as Rh factor, is a protein found on the surface of red blood cells. The presence or absence of this protein is a key component in determining a person's blood type. If the Rh protein is present on the surface of red blood cells, the person is considered Rh positive. If the Rh protein is absent from the surface of red blood cells, the person is considered Rh negative. Under a microscope, the Rh protein would appear as small markers or receptors on the outer surface of the red blood cell. These proteins play a role in the body's immune response and are critical in blood transfusions, organ transplants, and pregnancy. The concept of Rhesus factor is the reason why blood groups are termed positive and negative, for example, A positive, A negative, B positive, B negative and their likes. It's important to know that Rh positive and Rh negative are incompatible. This incompatibility occurs in the individual having the negative Rhesus factor on their red blood cell. For instance, if an Rh negative person receives Rh positive blood, their immune system may recognize the Rh positive antigen as foreign and produce antibodies against it, leading to hemolysis, that is destruction of the red blood cells carrying the Rh positive. How then does Rhesus factor affect pregnancy? If an Rh negative mother is pregnant with an Rh positive baby, her immune system might produce antibodies against the baby's blood cells. These antibodies can cross the placenta and attack the baby's red blood cells, leading to complications. This complication arises because of the negative Rhesus blood on the mother's side, as discussed earlier on blood group compatibility. This complication can only occur if the mother is Rh negative and the baby is Rh positive. It is worthy of note that this complication don't occur in first pregnancy. This is because the placenta usually acts as a barrier between the mother's and baby's blood. That is, both maternal and fetal blood systems are separate, preventing direct mixing. Hence no antibodies are formed, since antibodies are only formed when the immune system suspects or notices the presence of a foreign antigen, which in this case happens to be Rh positive blood. But after her first delivery they tend to be this contact between the mother and neonate blood. This contact triggers the mother immune response, causing the release of antibodies. This antibodies cannot harm the just delivered baby since he's already birthed, but can affect the next pregnancy if the baby is Rh positive. How Rh factor affect the baby? Rh incompatibility can lead to conditions like hemolytic disease of the newborn, HDN, jaundice, anemia, and in severe cases, stillbirth. Diagnosis for Rhesus factor is blood grouping to identify the presence or absence of the Rhesus protein on the red blood cells. Treatment and prevention for Rhesus factor. Rogam is an injection given to Rh negative mothers during pregnancy and within 48 hours after delivery to prevent the production of Rh antibodies. Understanding your Rh factor is crucial for a healthy pregnancy. Early testing, monitoring, and treatment can prevent complications. If you're pregnant or planning to be, talk to your doctor about your Rh factor. It's a small step that can make a big difference.